Today's date is September 3rd, 2020. We're here with Virginia, who is a retired registered nurse and has really been through the gamut. And she has an amazing medical history. But the reason why we're making this video is she's got sudden onset of pain 6 months ago in both hips, both the right and the left. She awoke with it. She was able to fix the left hip on her own with essential oils and doing other things, and it went away, but the right hip has remained, and no one knows why. She hasn't seen an orthopedic surgeon yet, and we don't have an x-ray at this time. And this was sudden onset. The day before you were fine, correct?
Right.
Okay. The first thing I want to, now you said most of the pain occurs when you get up and sit down, correct?
Get up and sit down, and if I do any kind of lateral motion quickly,
Okay, let me see you walk to the door and back.
it's that getting up that hurts.
Okay, and back to the chair and sit down. Okay, and you have had no conventional treatment, is that correct?
No.
Okay, thank you. And I have your permission to video and post you.
Absolutely.
Thank you. We just made a little bit of Procaine injection into a post at number 28. And before we did that, you couldn't flex your right hip more than about 90 degrees.
Right.
Right? Okay. So we're going to see what you can do now.
Okay.
I'll have your hip.
Let me see. Oh, wow. That's amazing. It pinches there.
And I want to show the viewer what we've got. That's significantly more than 90 degrees. What was that you said?
I said, that's amazing.
You started with wow.
Yeah, well, wow, because I mean, my goodness, I've been trying to get my leg up to my knee up to my chest as part of what I've been trying
Let's
to
see
do.
you do it now. I should have videoed this beforehand. And I'm going to say wow, because show the viewer what you were able to do before I did that.
Oh, here.
You were right
I was
there.
right there.
Yeah.
That's
Okay.
amazing.
Surprised?
Yeah.
And you don't know why yet, right?
No, I don't know why yet.
Okay.
That's pretty cool.
Okay. I also want to check your rotation.
Okay.
What was that you said?
I said, oh my goodness.
Okay. This is hard for me to do, but I'm showing the viewer now. I'm rotating your hip. Let's rotate it. You do it, actually.
I can do it.
Wow. You couldn't.
I couldn't do that.
No.
That's amazing. Huh?
Okay.
Look at that.
That's incredible.
No, I can't go that way.
It's that's called internal rotation, and that's tough. You couldn't externally rotate.
No.
All right. The I2s. So that's number 27. Okay.
Was it 27 or 20? The first one?
Well, the first one I did was a post, and that was not in the eye tooth or the canine. That would be in the first premolar. So let me see you bring your leg up. You can pull it up all the way and with force. Oh my God, you couldn't even get close before, right?
I couldn't get, are you kidding? I would have been crying by now. It wasn't that I would have my husband try to help me stretch because I thought I've got to be able to move my leg. And I couldn't.
And let's see you rotate it.
This
Bring it
way?
up. Yeah. You're actually putting force on that.
Yeah.
We couldn't get anywhere with that before.
No.
Okay. And again,
And I certainly wouldn't have done this like this because it would hurt.
let me see you get up and walk to the door.
Oh my goodness.
What?
Oh my goodness, that's amazing. That does not hurt. I can't tell you, I have been walking around like Chester from Gunsmoke. That is amazing. And I can't even tell you, that's amazing. That is amazing. Really and truthfully, I would try to just walk slow enough so that I wouldn't limp. And it had gotten to the point that no matter how slowly I walked, I limped. And I'm too young to be this old. That's amazing.
Are you surprised?
I'm totally surprised. Nobody's ever done anything like that.
You've been in medicine a long, long time. You're a nurse who's been the rounds. You made the gamut, you said, right?
I was 43 years.
And
You
you've
know.
never seen anything like this where somebody could get better instantly.
No.
Let's see you sit down in the chair.
Yeah, it's hardly as much pain as it was before. It's still a little painful, but the test is getting up, and that was so much easier.
That was instant.
Yeah.
All right, come on over here. I want to show you what we
Okay.
did. All right, you have 27 is the canine, and 28 is where your post is, okay? So what I want you to do is just drop down and take a look at what joint is involved in the canine.
In the canine, I should have brought my glasses.
This is gallbladder, liver, and
Connective tissue diseases.
right here,
Oh, here we go. What's posterior hip?
hip,
Mm-hmm.
posterior knee,
And hip.
and hip, okay?
That's amazing.
Now, that's what
That's
people,
amazing. I don't think I've ever seen anything like
no,
this.
you haven't. I'm sure you haven't.
No.
But this is why I wanted to know where your root canals were, where your missing teeth
Yeah.
were, and again, you're a polished retired nurse. You have seen everything. All I did to diagnose this first was I had you put your finger on the location, right?
And then muscle test.
And then I muscle tested you, and you were shocked at how weak you got,
Yeah.
right?
Yeah.
Because in the clear, when I do this, hold, you're nice and strong, and I'm pushing, hold, you can feel it. And then when you touch that tooth,
Yeah. Whoa.
you collapsed like with if I took my baby finger,
Yeah. Exactly.
you just dropped it, right?
Exactly.
Okay, so have a seat.
That's amazing.
Make a long story short, most people come to me thinking I'm going to shoot ozone into a joint or, try and do something along that line. But I try to avoid injections if I can help it. In your particular case, you had dental history, and in dental history that is in a tooth that affects that joint, the hip joint. And when I muscle tested you, it was positive in that area. So what I did was I put a little bit of local anesthetic to the tooth, and it doesn't cure it, but it temporarily breaks the circuit.
Yeah.
Am I making sense?
Yeah, that does make sense.
So we took it out of the circuit temporarily. It might last minutes, hours, might even last days. And now I know that the focus of your problem is coming from a tooth. And that's not going to be my province at that point. It's going to be a dentist. Am I making sense?
Yeah, so I should have that tooth pulled?
You need to have that evaluated by a biological dentist. And we'll talk about that now,
Yeah.
not on the video. And then you'll go from there.
Okay.
But I don't intend to inject your hip.
Wow.
Don't need to. But if you had gone to an orthopedic surgeon, he would have shot your hip up as well.
Sure. Yeah.
With cortisone and maybe made you worse.
Yeah.
We were just discussing drugs. You're a nurse, you know how bad these drugs are, but you said you're taking ibuprofen.
Yeah. 600 milligrams, and I tried to take it once a day, usually before bed. But some days it just hurt so bad I'd take it twice and sometimes 3 times because it hurt.
Right. Did it rip up your stomach, the ibuprofen?
No, because I always made sure that I took it with food.
Okay, very good.
Because because it'll rot your stomach.
My opinion is if you had gone to an orthopedic surgeon, he would have x-rayed it, found nothing, and then offered you a cortisone injection or something worse. And this was an energetic problem.
Right.
Right?
Well, and I agree with Dr. Odom when he said, I don't have a steroid deficiency.
Okay. I appreciate Dr. Odom referring you.
Walking better, right? He didn't shoot up my hip. He shot at my tooth.
What?
Yeah. And I can pull my leg up.
Really?
Look at this. I can lift my leg up. I couldn't lift my leg up. Anything that made me feel like I had to lift my leg up, I was screaming.
This is not the placebo effect, right?
Are you surprised at what she can do right now?
Yeah.
And my, what do you call it, my extension?
So what does this mean? You have to go to a dentist?
Yeah.
Yes, she does. So you're surprised
Doc, my
to see-
hip's hurting me. Start drilling.
Yes, you're surprised to see this too, correct?
Yeah. Oh,
Okay.
yeah.
I'm going to be putting this on YouTube. Do I have your permission?
Yeah, you do.
Thank you very much.